My name is Lim Tai Tian. I'm a cardiologist, an interventional cardiologist. Mr. Chua was like a lot of patients. There's nothing wrong with me. I walk every day and I feel great. When I started to ask him some questions and assess his risk factor profile, I said, well, there may be something going on. So I ordered a CT scan and it indeed showed that all his 3 arteries had a significant blockage. So this is the coronary angiogram of Mr. Chua. This is the main artery. At the end of the main artery, you can see that it narrows down to about 70%. And then the origin of the artery to the front has a 90% blockage. So there are a lot of blockages, and you can understand why it's complex. So in the beginning, he was very reluctant. He says, no bypass surgery. I'd rather die, yeah? So I said, well, there might be a compromise. I know of a surgeon who I've been referring patients to when he was at the university, and I know he also does minimally invasive bypass surgery. You may be a candidate for minimally invasive surgery where we don't need to crack open the chest.
My name is Full Professor Theodoros Kofidis. I'm a heart surgeon, senior consultant heart surgeon. Mr. Chua was a typical coronary stenosis case. That means the coronary arteries on the heart are blocked. So the referral came indeed by Dr. Lim for the eventual bypass procedure that should resolve the problem. Now, a bypass procedure is the connection of a graft between the aorta and the target artery on the heart. The blood now can go in a different way. It doesn't have to go through the blockage in the heart's own artery. And we do that 2-3 times during the same session on the heart. So every patient walks out with 2, 3, 4 bypasses depending on the extent of the disease. For the last 10 years or so, minimal invasive bypass surgery emerged, and this technique has now started spreading around the world. What is the difference? We don't touch the chest bone. We enter the chest through a small cut under the left nipple, and we indeed can conduct the full bypass surgery from there. When you cut the chest bone, person is limited in the way he sleeps for a couple of weeks. He cannot carry luggage, he cannot drive, cannot swim, cannot play golf for quite some time. And the overall trauma to the body is bigger. So these are the advantages of the minimal invasive, both for heart valve as well as bypass. Patient recovers faster, is back on his feet faster, less pain, also less infections, less bleeding, less re-explorations because of bleeding. All these are benefits of the minimal invasive.
People are often misinformed that bypass surgery is a high-risk surgery. And of course, they hear horror stories of bypass surgeries which went wrong in high-risk patients. We had multiple discussions, not just one. I think even the day before he had this bypass surgery, he said, I don't want to do this. I think we had 3 or 4 follow-up consultations until he was convinced this was the right thing to do.
So the procedure I carried out on him was a double bypass. That means that access from here, cannulation from the groin, go on the heart-lung machine. We never stopped the heart. We managed to do not only minimal invasive, but on the beating heart as well, and connected 2 bypasses, basically 1 artery and 1 vein. And the flows in the bypasses were very satisfactorily good. I was very happy with the result.
Immediately after surgery, I asked him, do you have any pain? No. When I saw him on the second day, I feel great. When can I go home? I joke with him that he's stubborn, and I think we had a good chemistry.
Our country is not a large volume heart surgery country. We're not doing like 500 cases a year. So it takes many years to reach the critical mass of patients so you can be solid on your feet. It took me also about 10 years to bring it to this level.
You have to be very skilled at it, and you have to be trained in it.
The young surgeons right now who have a roadmap of 20, 30 years of career ahead of them, they will all turn in some form or another to a minimal invasive surgeon. The best legacy is to train and inculcate knowledge into younger people to continue the craft.
One of the reasons why I choose cardiology, and especially interventional cardiology, you can diagnose yourself, you can treat, either with medication or with an intervention. It's the satisfaction that people come to you. My wife always complains that I immediately pick up the phone when it's related to medicine. When she calls, I'll sometimes leave it.
I became a heart surgeon following my decision to become a doctor. So I wanted to go to the heart because it's challenging. It gives me a great feeling of expanding my soul space. I think that by helping people, I become a better person, and so my whole life becomes more worthwhile living.